Morning to all of you.
Good morning.
How is your morning? Okay, ready to face the day. Yeah. Today we are so glad that the School of Postgraduate Studies can be with you. You know, we appreciate the Scholars Chapel so much. It is not about preaching. The name is what? Scholars Chapel. And so we have to learn new things. We have to learn what can help us in our academic work, in our personal life, and so on and so forth. And so, let's learn something that can help us and our family members. You know, in our home, when we go home. In the church, we are getting so much sick. And it is only in Africa that, for example, when a breast cancer is detected, it has gone to the last stage. Many breast cancers, for example, or many cancers, for example, when they are detected very early, they can be treated. They can be treated. So this morning, we want to learn what we call self-care management. And before I go any further, I would like to introduce my team at the School of Postgraduate Studies. I have here Dr. Susan Baker, who will be presenting with me. Okay, and then I can see Dr. Josephine Ganu. Maybe you can also stand up and wave. And then our administrative secretary was the one who led out in the song service, Jane. Any other faculty here present? Maybe they are coming. Without wasting much time, let's go into it. And I want to begin with John 3, 3 John 2. Our popular health verse in the Bible, Adventist. It says, "Beloved, I wish above all things that thou mayest prosper and be in good health, even as thy soul prospers." John has in mind here general prosperity. Of course, that is what the first part of the text says. General prosperity. It means to be successful. And so the Lord wants us to be successful, to succeed, not only in spiritual life, right? Also in what? In physical health, in our social life, and so on and so forth. But many a times, don't we concentrate only on spiritual life to the neglect of other aspects of our life? In Adventists, we concentrate so much on spiritual life. Many a times, we even neglect physical health. That is not how it should be. The four are very crucial. The opposite is also true. When the health of the body is neglected and bad physical habits are established, the religious life also suffers. True or false? True. Yeah, very true. If you are sick, spiritually you cannot function properly. You cannot. And so the advice is balance development. It says the neglect of the physical, social, and mental life for the religious alone is what? Harmful. Balance is essential to successful living. So balance is what? The key. It is the work of the devil to deceive us that only spiritual life is important, and we neglect our social life. We neglect our physical life, and we neglect our social life as well. And so we have said that every SDA member should be a health what? professional, the church believes that health is a core part of the gospel, and that health is an important part of the life and mission of the church. We Adventists, in fact, we believe that we should develop holistically. And what is that holistic development? Development in our spiritual, social, physical, mental. Today, I want us to live here knowing very well that as an Adventist, we need to develop holistically. We need to develop holistically. There are 4 levels of prevention. Very quickly, we have what we call primordial prevention, which is prevention of risk factors. And then we have primary prevention, prevention of occurrence of disease. Then we have secondary prevention. When disease has already occurred, we prevent the progression of the disease. Then the last stage is what we call tertiary prevention. You could not prevent the disease. It has occurred. You could not prevent the progression. But then we want to prevent the disability. Those are the 4 levels of prevention. And this morning, I want us to concentrate on what we call secondary prevention. In secondary prevention, there is what we call early detection. Early detection. Early detection refers to, there are many measures taken to detect disease as early as possible when the disease is easiest to do what? To treat. And one excellent method of early detection is what we call screening. Screening. And that is what we want to concentrate. It's very simple, but very crucial for our physical health. And so I would like to invite our dear Dr. Susan. This morning we will look at screening in high blood pressure, or we popularly call it hypertension. Do you know hypertension is also called the silent killer? Why is it called the silent killer? Who knows? Yes? It kills you slowly. The thing is, the signs and symptoms will not show until it has reached the last stage. You might be, many of you here might be having some high blood pressure, but you may not know. You are walking out, easily. The signs and symptoms will not show. So this morning, we would like to find out how we can screen or how we can detect hypertension at the early stage.
Good, thank you, Doc. Okay, now I am emphasizing the early detection also. The reason why we are doing this is to show you the importance of early detection, but also to show you some simple methods that you can use to monitor your own health. And that's important. Sometimes we just wait till we go to the doctor. How many of you wait till you go to the doctor? Don't raise your hand. Don't raise your hand. Don't raise your hand. But we want to emphasize these are simple measures that can save your life.
Exactly.
All right? So, what I need, we're talking about blood pressure right now or hypertension. I need somebody who has on a short sleeve shirt to just come and sit right here.
A volunteer.
Volunteer, please, quickly.
Good.
Now, this, you see that Doc has on the screen what we call the sphygmomanometer. Say that with me. The sphygmomanometer. All right, that's what you often see when you go to the doctor's office. You know, they've got this, they put the cuff on, the doctor has the stethoscope on, right? You know that measure, but you can buy a simple digital machine that you can use at home. This makes it so easy to monitor your blood pressure. All right, you don't need to be a physician. Now we emphasize New Start as health practices. All right, so keep in mind New Start, but we also want to emphasize that you can use these at home. I looked this up on Jumia. How many of you know what Jumia is? Yes, Jumia is the Amazon of Africa, right? You can buy whatever you want. You can get these on Jumia. In your country, it may be called something else, but you can get it. You can buy these at the pharmacy, and they're not that expensive.
Even if you go to Rongai Pharmacy, they are there. They are there plenty.
Okay, now I'm going to ask you, thank you for volunteering. I'm going to ask him, you do this at home. Now, I'm going to do it now, but I want you to remember, you do not need a person to do this. He can set this up himself. This is a self-measure. Let me show you how easy it is. First, you need to be sitting. Now, in my background, I'm a physical therapist. In my background, we take blood pressure sitting. We also take blood pressure standing because your blood pressure changes when you stand up. And as a physical therapist, we want to know. We also take blood pressures when people are lying down. But the classic way to take your blood pressure accurately is sitting. Now look how he's sitting. He's sitting here perfectly. If he had his legs crossed, no, from here. If he had his legs crossed, we'd ask him to uncross his legs. All right, okay, we would ask him to roll his sleeve up so that we can get the blood pressure cuff on. And if he's talking, which people often do, we ask him to stop talking. Because you want to have as perfect a position as possible. Now, I don't want to turn my back to you to do this, but look how easy this is, folks. All right? Look, you got to get this right. If you remember, all you need to do is put this part down the center of your arm, because this brachial artery is what is measuring the blood pressure. All right? So it's really simple. Put this down the middle. Pastor, put your hand in there. Good. Okay, you want to get it tight.
And Susan, you know,
too tight.
the stethoscope here, this should come down. It should not go up.
Okay, good. We're going to ask him to relax his arm. He's perfect. All right? Then what do you do? Folks, it's digital. It does everything itself. All you have to do is turn it on. Now, I'm going to turn it on. It's going to measure the pastor's blood pressure. But guess what? Guess what? Two things. I'm not going to tell you what his blood pressure is. All right? Because I don't want to violate his privacy. He's volunteered. What? He said it's okay. All right. And to you, Pastor. So I'm going to tell you two things. Because this tells you two things. It tells you his blood pressure, and it also will tell us his pulse. Now, I did not wear my white jacket today because most people, when they go to the doctor, the white jacket makes their blood pressure increase. We call it white coat syndrome. So I just wore regular clothes so that he wouldn't get an elevated blood pressure. Now remember, Doc, are you going to put the blood pressure?
Yes, I'm going to do that.
Yes, okay.
Let me do that, or maybe he takes it before.
Okay.
Let me put it on. Let me put it on.
Okay, while he's putting it on, let me remind you, when you're taking these measures, you don't only pay attention to one reading. So if his blood pressure is a little bit on the high side today, I'm not going to say, oh, Pastor, get to the doctor. Right? And you're not going to do that. You need to take consistent readings over time. What we recommend is that you keep track of your readings so that when you go to the doctor, you can show him, look, I've been taking my blood pressure for the past 2 weeks and this is the record. That way you are participating with your physician or your healthcare professional to protect your health. That is what is so important. All right, and your doctor will love you because he recognizes that you're trying, he or she recognizes that you're trying to be a partner. Okay, so let's turn it on. All right, when you turn it on, you'll notice that it starts buzzing. And what does he feel? What's he feeling right now? He's feeling that cuff tighten up because that's how it measures your blood pressure. If I were listening with the stethoscope, I would be listening for when I can't hear his heartbeat anymore, and then when I can hear his heartbeat start back, and that's how you manually measure blood pressure. But that's a little bit more difficult. Right now we're showing you what you can use at home. Okay, so it's running up. Pastor is perfect.
He's perfect.
Yes, he's perfect. Look at the chart.
Now, let me just explain this on the chart. You see we have categories, isn't it? We have normal when you're systolic. Susan, what is the systolic pressure? And what is diastolic?
Okay, these are the two measures of how efficient your heart is working. So your systolic pressure is when your heart fills with blood. Your diastolic is when it empties. All right? These two measures let us know how well your heart is working. And that's what is preventive here. Because if you are monitoring your heart, then you know something about your cardiac health. And you know that if your heart stops right now, you're in trouble. Right? So it's important to monitor your heart. Now let's look, since Pastor gave permission, Doc, we'll let them look at the chart.
Yes.
His blood pressure is 137. That's the top number, over 78.
Good. So you look at it. Which one is 137? The systolic, isn't it? Yes. And the diastolic is what?
Is 78.
78. So which category will you place in here? Normal, high normal, stage 1, hypertension, stage 2, moderate, stage 3. He falls under normal. It's normal.
He does.
And this is, you see, when you go to the hospital, this is what the doctors use to confirm whether you have hypertension or you are at the pre-hypertensive period or you have stage 1, stage 2, or stage 3. When they take your blood pressure, they look at these figures. So, you see, it's very simple. You can buy these and you can continue checking your blood pressure at home. Your wife, your children, yourself.
That's right.
And the silent killer will be kicked away.
Okay, this monitor also tells us his pulse rate, which is a measure of how hard your heart is working. We don't have the pulse guidelines up there. They'll show up in a minute. But his pulse rate was 82. All right, now he's young. He's good weight. He's probably his resting pulse rate is typically a little bit lower. But since he was sitting up here demonstrating that, probably elevated his pulse rate a little bit. But still his pulse rate is within normal limits. So he's healthy right now with this. All right?
Okay, thank you very much. Let's give Dr. Susan a very good. Thank you. You see, beloved, hypertension is one disease that is very common in our society. The reason is that it is one single disease that has many risk factors. I can count 10 risk factors for hypertension right now. And that is why we have to watch it. Number 2 is diabetes. Diabetes. What do you have to say about diabetes?
Okay, hypertension, very important. Diabetes, probably second most important, or even competing with first. We know in Africa, we know in America, diabetes is epidemic. And in Africa, it's starting to be that way. That's why this chapel is so important, because there's a simple method that you can use at home. Now, I'm not going to ask for a volunteer for
Now,
this.
Susan, before you go that, you see, diabetes and hypertension are twin diseases. When you get one, the other one, because they are twins, it will come. It will definitely come.
Right, very true. Now, I'm not going to ask for a volunteer, because with this simple measure, you can measure your blood glucose at home. We call this a glucometer, health professionals, but most people just call it a blood sugar monitor. All right, so how does this work? Okay, it measures your blood, which means you have to take a sample of your blood. Okay, so this is the measuring device. These are usually very cheap. In the US, these are free, basically. I think here it costs like $5 when I looked it up on Jumia. The thing that costs a lot of money are the testing strips.
Maybe remove one for
I am going to, because I'm going to do my own glucose today and see what it is. All right? So this is the strip. Look, it's just a little strip.
Yeah.
One end you put into the glucometer, and it automatically turns it on. All right? The other end is where you put the blood sample. How do you get the blood sample? By biting your finger? No, you take what we call a lancet.
Lancet.
This is a very thin gauge needle. I hear somebody laughing. This is a very thin gauge needle that is in this nice little pricker. You push it down, you put it, Doc, would you hold that for just a second on that end? You press it, look, I'm making blood go to my fingertip, right? So that it's easier, that's all, okay? You press it to your finger, you push the little trigger, and it goes, ouch! No, it doesn't go ouch, because it doesn't even hurt. Oh, it doesn't hurt me. No, it pricks a little bit. Okay, so I get enough blood.
Very little blood.
Very little blood. Very little blood. I put it right here in the sample, and it starts immediately counting down to give me my blood sugar. All right, what is it, Doc?
103.
Okay, my blood sugar, do we have the normals?
We have the normals there.
Okay, now, look at what you've got up there. According to that chart, where am I? At 103, where am I? Okay, now, let me tell you something that you always need to keep in mind. You can use this fasting when you haven't eaten overnight, or you can use it during the day. After you eat, your blood sugar is going to go up. That's normal. That's what's supposed to happen. That's how your body metabolizes your food, by throwing sugar at it so that it can metabolize.
Okay.
All right, so guess how long ago I ate breakfast? Just about a half an hour, 45 minutes ago. So with that in mind, my blood sugar is actually perfectly normal. Because after you eat for about...
It goes up automatically.
It goes up, then it takes about 2 hours for it to go back down to normal. All right?
But Susan, we will encourage you, if you buy this device and you want to know the accurate reading, we call it fasting blood sugar test. Fast for at least 12 hours. When you go to bed, the last time you eat, let's say 8 o'clock in the night, 12 hours will bring you to 8 o'clock in the morning. When you take it, it will give you the accurate reading. Now, Susan, Dr. Susan has eaten this morning, so we are not very sure and it put her in a pre-diabetic. But we can be sure if she has not eaten her breakfast, the reading will come down to less than 100.
But now, if your physician tells you that you are in a pre-diabetic or a diabetic stage, they're going to ask you to take your blood sugar throughout the day. Because just one reading in the morning gives you a good indication. And if your readings are always normal, you know, there's nothing to be concerned about. But if your readings in the morning are on the high end before you've eaten anything, then you're going to want to monitor your blood sugar throughout the day.
Exactly. Then you monitor. Are we done with diabetes?
Yes, yes. The VC is saying there is a range. Now, what Dr. Ganu has up here is the normal range. You can look on the internet and you'll see that there are other guides that will give you specifics. If it's been 2 hours since you've eaten, they'll give you the range. If it's been 6 hours since you've eaten, it'll give you the range. All right, all that's on the internet.
Okay. Okay, now let's go to a simple device called thermometer.
Okay, how many of you know what a thermometer looks like? All right, so I brought 2 new versions that you may like. If you have small children, I recommend that you get one of these. All right, because if you've ever tried to put a thermometer in the mouth or in the backside of a small child, you know that it can be really tricky. All right, so this is a digital thermometer that you put under your tongue. Typical. All right, the nice thing about this is you don't have to read it and try to figure out what it's saying. It tells you in numbers what your temperature is. All right, this is very nice. We have 2 or 3 of these in our house. All right, but this is a digital, I need a volunteer. Please, anybody. This is a digital thermometer. All right, the beauty of this is you don't have to put it in your mouth, you don't have to put it under your arm, which is another place that we take temperature, and you don't have to put it in a child's rectum, which is where, those of you who are parents know, that's where you take your baby's temperature. We don't take adult temperatures rectally, but we do take baby temperatures rectally. But this device is really cool, very cheap. You turn it on, you'll see that it's registering here on one side. On the other side is a laser. All right, a simple, human-safe laser. Now, what I'm going to ask you to do, what you want to do before you use this is just make sure you don't have oils or anything on your forehead. So I'm going to ask her to just take this little alcohol wipe and wipe her forehead. Good, right down right between your eyes. That's because that's where we're going to point it. All right, and then I'm going to ask her to fan it, because if you're sweating or if you've got oils, or, you know, if you have your glasses on. Now, she doesn't wear glasses. How nice. Okay, but any of those things will knock this off. Okay, so she's ready for us. Doc, would you tell us what normal body temperature is?
The normal one is about 36 if you are using Celsius, right here. And if you are using Fahrenheit, it's here. It can be 36.5, between 36 and 37, we can say is normal. So let's see what the readings will give us.
Okay, it's taking a little bit longer than it typically does. All right, and it may be that that alcohol is still a little wet. All right, because normally what it will do, it will tell you if you need to move closer to your forehead. It will write that on there. It will also tell you when it's taking the temperature. All right? So So, and after it takes the temperature, you'll hear a little beep. Did you hear that beep? That was to tell me that it's ready. So let's try again. Okay, okay. We've got 98.6. What is that? That's normal. Okay? That's 98.6 Fahrenheit. All right, sorry, I used that. Thank you, my sister, for doing that. All right, maybe I need to clean my device. With these, you just need to keep them clean. If they're not working regularly, you know that it will tell you what's wrong with it. But this is a wonderful tool. Why do you need to monitor your temperature, Doc?
Because your temperature actually is not a disease. When your temperature rises up, it is an indication that something is not going on well in the body. So even if you have headache, your temperature goes up. If you have some other problem, your temperature goes up. So when you take if you have infection, it goes up. And that tells you that, hey, the body, something is in the body that is not right. That alerts you. And then you can seek medical help.
Good. Typically, you know when you get ill, a lot of times you get a fever. We feel our heads and say, oh, I must have a fever. It's much better to take your temperature and see what your temperature is. Temperatures over 100 degrees Fahrenheit, 100.4 Fahrenheit are considered cause for follow-up. Not necessarily alarm, it's not like you're going to die, but over 100 is the cut mark. It tells us something's wrong, something's going on.
So we said anything between 36 and 37 is what? Normal. So, and if you are using, now in my home, I have the one we put under the armpit. And then you wait, you hear a little beep, beep, and then it's digital, you can also read. And this is very crucial, especially for those of us who have small children at home. Our children can easily pick infection, and in the night, and I have a daughter, I always take her temperature. And there was one night, around 1 o'clock a.m., she became a bit hot, and I took her temperature. It was over 100. So that gives me a cause to quickly go to the hospital, isn't it? When you have children in your home, these devices are very important. Let's go to the next one. Yes.
Okay, let me talk a little bit about this lovely little device. It's called a pulse oximeter. Now, we use this because this device tells us two things. It tells us our pulse, but remember your blood pressure cuff did that too. This tells us your pulse, but this also tells us the percentage of oxygen you have circulating in your blood. All right, so you would think you've got to have a blood sample, but you don't. This instrument works with no blood. It just works with the tip of your finger. So I need a volunteer. Volunteer, come please. This is not invasive. It's not going to do anything. Thank you, Pastor. This pulse oximeter is like the blood pressure cuff. Pastor, please have a seat. You can use it standing, and we often do. You can use it sitting. You can use it lying. You've probably seen this in the hospital. A lot of times they have it hooked up to a monitor because they want to know when your circulating oxygen drops below 90%, something's wrong, and you're in trouble. If they have COPD or chronic obstructive pulmonary disease, if they have allergic reactions, if they have heart trouble, it's important to know what the oxygen is, what the level of oxygen is circulating. And that the pastor came up because with women, we put your finger in here and it measures your circulating oxygen just by monitoring the oxygen in your fingertip blood.
in your pulse rate.
And your pulse rate. Now, I'm saying I'm glad one of the females didn't come, because if you have on fingernail polish or...
Yeah, let me speak a little bit on this, and Susan will come up. For weight management, we have what we call body mass index. In centimeters, we can convert that for you, but you can see us later. But now...
Okay, Doc, let's tell them too, there's an app for that.
Okay.
All right, there's a BMI app.
Yes.
And if you've got your phone, if you...
Easy for us. But if you want to calculate it yourself, you need to know your weight.
Yes, we will. Okay, we'll do an
The
example.
time it will, okay. Okay. but let me I use myself. My weight is 70 kilograms now. You have to keep taking your weight, and that is why we have this here. The bathroom scale we will soon. And then my height is 1.7 meters. And for our formula, the meter should be squared, isn't it?
Yes.
Good. So we square 1.7 times 1.7 is 2.3. And then you divide 70 by that, you have this. What does this mean? We have a guide. If that figure is less than 20, you are what? Underweight. If it is between 21 to 25, you are normal. And 26 to 30, overweight. And then 31 to 35, obese. But if it is more than 35, you are morbidly or grossly obese. Now, Susan.
Now, folks, we laugh a lot of times when we talk about weight, but weight is no laughing matter. You know, we know that every risk factor is increased when you're overweight. So the best thing you can possibly do to manage your health, along with all of these other measures, is keep track of what your weight is and keep yourself within a normal BMI range. All right? Okay, so now let me say too, Doc, underweight has its problems too. We often focus on overweight. But if you're underweight, that has health risks also. Not as much as being overweight, but there are risks for underweight. Okay, so bathroom scale. I have a digital one. You can tell I like digital. All right? Every home should have a bathroom scale. All right, what do? You know what you do. It's in your bathroom, you've got it on the floor. Typically you don't put it on carpet, you put it on a flooring rather than carpet. Okay, so Pastor, you volunteered. Good. Hey, come on, everybody knows what to do. Now, wait. Because ladies, say amen if you know this. But typically you take off as many clothes as you can.
That's why it's in the bathroom.
Before you take your weight. All right, and what you want to do is do the same thing almost all the time. So if you take your weight fully dressed like this with shoes on.
Even with her phone in his hand, and the keys in her pocket.
Come on, I take my shoes off, I take my, well, let's not even go there. But you know, we want to get the most accurate weight possible. And when you have on a minimal amount of clothes, then you have your accurate body weight. Okay? All right, so Pastor, what do you do?
No.
You don't have to. No, go ahead. Okay, so you just step on. Now, most bathroom scales, they can either be in meters or in pounds. I inadvertently set mine to pounds, but I know that kilograms is something that you're a little bit more familiar with. Okay, so step off, Pastor.
Let me give you just a simple conversion factor from pounds to kilograms. If you have it in pounds, you just divide it over 2.2. Then you have the figure in what? Kilograms. You divide it by what? 2.2.
Okay, good. So we're having Pastor step back on. You saw all I did was just tap the button in the back to change it to kilograms. Okay, so his kilogram weight is 83.1.
Oh, brother.
I'm sorry, Pastor. I didn't ask you if I could say that. I'm sorry, Pastor.
But why did we say, oh, you see, with a mere look at the figure, you cannot judge whether he is overweight because our weight depends on our height as well.
That's right. That's why we use BMI, because BMI statistically averages it out. It takes those two variables, weight and height, into consideration. So my BMI, is different because I've got different height, different weight, so is his. Now, in the interest of time, we're not going to be able to calculate the pastor's BMI. But let me tell you two things. Yeah, really, it's an inconvenient truth, but most people carry too much weight. Really. And as you get older, trust me, your weight is going to increase. So if you can hold your weight, if you can manage your weight as young as you are, no matter what your age, do that.
One thing with weight is, even if you gain 1 kilo or 2 kilos, it is difficult to do what? To bring it down, to shed it off. Very difficult, And so the advice is try not to put on the 1 kilo or 2 kilos, because when you do, it's an upheaval task.
It
is difficult to bring it down.
It is. Now, we couldn't tell you the pastor's BMI because we didn't know his height.
Yeah.
If we could have done this arithmetic calculation, or we could use a BMI app, which is easy. Now, I once was going to conduct a research study. Let me tell you, the BMI is normed on white, North American type people. We typically find that people of color have a little bit higher BMI. All right? But you want to keep your BMI under 25. All right? You want to keep it under 25 and you want to keep it over 18. Because if it's under 18, you're underweight. And as we said, that's not good.
Yeah. We have 5 minutes more, but let's go to the last two, breast self-examination and what? Mammography. We have what we call BSE, it's a breast self-examination, and CBE, clinical breast examination. And here we are saying that this is performed monthly immediately following menstrual cycle for ladies. And then we are saying that the rule of thumb is that when you are 40 to 69 years, you perform annually. When do we start? We start maybe when we are 20 years of age.
Okay, I'm going to reduce that age because I try to talk to teenage girls, once they've started their menstrual cycle, to start regularly doing a monthly breast self-exam. Now, we have more men in this room than women, but true or false, do men get breast cancer? Yes. Yes, yes, yes. Not in the proportion that women do, because men don't have as much breast tissue. But men should also periodically perform a breast self-exam. Now, I'm telling you this, women, if you're in the audience, this is something that we should be doing. Men, if you're in the audience, this is something you should talk to your wife, your sister, your mother, your grandmother. Make certain that they're checking their breasts every month to see if there are any irregularities. We don't have time to talk about the whole breast self-exam, but they should be feeling their breast tissue to see if there are any lumps, because that is the first symptom of cancer. All right, in the breast. They should also be looking at their nipples to see if there's any change in the way the nipple looks, because that is also a sign of breast cancer.
Now,
and then, of course, mammography.
Yeah,
Dr. Ganu just talked about mammography. We start mammography at a certain age, and it's typically 40 years old, unless you have a history of breast cancer in your family, and then we do it earlier. Mammography simply is a diagnostic X-ray type way of looking inside the breast tissue to see if there are any irregularities. Women, if you've had it, you know it's something that we don't particularly like to have, but it's a lifesaver. But the first lifesaver is doing those breast self-exams monthly.
You know, Susan, one thing I like about mammography is that when the lump is even very tiny, the X-ray, the mammography can pick it up. And at that stage, it is easily treatable. But you know, we have said, and statistics have said, breast cancer is one of the most common cancer among women, isn't it?
Yes.
And in Africa, it is killing most of our women. But if only you can just go for that X-ray, it is a screening test. You don't have to feel anything. You just walk in yearly when you are 40 years and above. If the lump is tiny, even if you don't have any pain, the X-ray can pick it up. And the lump can just be removed and you are okay. Yeah, mammography has saved a lot of lives. Those women who go. There are some women, your breast tissue is very dense. And the doctor may recommend to go for ultrasound, which is very good. So these are and the last one probably we have 1 minute. The last one we want to talk about is the prostate cancer screening.
Okay, and I'm going to talk very fast. I wish we had a little bit more time, because most of you should be concerned about this. I'm going to gender difference it again. Women, you should be talking to your brothers, your husbands, your fathers, your grandfathers about this.
But you know, Susan, it's not fair. Men can have breasts, but women cannot have prostate.
That's right. Women cannot have prostate cancer. Don't believe it if a woman tells you they have prostate cancer. Because to have prostate cancer, you have to have a prostate. All right? Okay, so women, please talk to your male family members or friends, church members. Men, all of you should make certain that you are getting either a digital rectal exam or a prostate-specific antigen PSA screening if you're over a certain age. Now, look at this. Age to start screening 40, unless you have a history of cancer in your family. And then we started early, like sometime in 20s. All right? Because prostate cancer grows very slowly, but it grows consistently. And if you can catch it early, it's good. What is PSA? PSA is where they take a sample of your blood and measure your prostate antigen. All right? It tells quickly whether there's some problems with your prostate. And just because you have an elevated PSA doesn't necessarily mean that you have prostate cancer. You may have benign prostate hypertrophy, or BPH. Okay, so don't get too excited, but get the test. Now the other test is the test that men don't like, and I'm going to try to be as delicate as possible with this, or Doc, unless you want to take it. The other is the digital rectal exam. That is when your physician puts a glove on his hand and inserts one of his fingers into your rectum. Okay. Men, I know you're all very quiet, so let me just proceed. The reason why we do this is because it is very easy to detect if your prostate gland is swollen. And feeling it going through your rectum is very easy to feel your prostate. So that's why we say do digital rectal exam, even though most men don't like it. All right, please, it can save your life.
It is one of the easiest way. I have wanted to bring a picture of the location of the prostate gland. It's a very small, the size of a walnut. You know, a walnut, very small. Your bladder is sitting on your prostate. You know, so you can easily detect it with your finger. And it's 9:03 now. Our time is up.
Our time is
we
up.
have to stop here, and then. If you want more of this, I think we can also pick one and go in depth in one of our scholars' chapel. We can go in depth. We just, give the surface of it. But we will recommend that you have or you get these equipments in your home.
Okay, two more things. Let me just say two more things. Ladies, you see that we didn't cover pap smears. Please, you should be having your regular pap smears as a cancer screening. Two, we do have a nurse's office. The dispensary is right outside of this door to the left. While you're here on campus, you can stop by and ask Nurse Rebecca to monitor some of these things for you if you have concerns. It's a good free service, all right? So take advantage. Third thing I want to say is don't forget, we're talking about prevention here, but we try to prevent at the very beginning any disease and illness by living a healthy lifestyle. And of course, New Start is that. We know that that's the classic Adventist approach to health. New Start, if you don't know New Start, please Google it. Yeah, there are many different New Start celebrations creation. There's a lot of acronyms, but New Start is probably the one that we know most. You can Google that. There's some nice materials on the internet. Pastors, women's ministry, children's ministry, you should be talking to your congregations as well as your own families about these very simple health management.
Thank you. How many of you think this information is helpful? Okay, how many of you promise you are going to get these equipment in your home? Wonderful. Please get them. Thank you. We will. VC, can you come and close us with a prayer? We want to pray. Let's rise up because our time is past.
Can we say amen, please?
Amen.
All of this is very, very valuable, and I totally support it. And every year I faithfully get my physical, and I seek to have the 8 natural remedies or New Start or creation, whatever it is, and seek to follow it. I would just add one part to you, Dr. Ganu, Dr. Baker, and that is that for ministers and teachers and educators, whatever your profession, if you can add this dimension onto what you do, you will exemplify and expand your ministry. So many people don't talk about these things. They think it's only for a physician. But Ellen White has said clearly that we should learn the 8 natural remedies, the basic remedies, not only the 8, the basic remedies like they talked about here, and practice them and share them with others. And by so doing, we will be doing the ministry of Christ. Amen? Yes.
Mr. VC, I have always said that if you are a pastor and you also have an MPH degree, you are most effective.
Yes.
That was a commercial, folks. That is very good advice, but I would just expand it a bit to say, in spite of that, the truthfulness of that I don't believe we should be confined to be doctors or MPH holders or nurses to have these basics. You follow what I'm saying? There's a basic level we're talking about today that's permissible and okay if we learn it well, but we're not going into diagnosing and telling people what's wrong with them and what they need to do or not do. That's not our role, but we can learn the basics.